It's a common problem that happens as we age.
Our spine degenerates due to the cumulative wear and tear that we've subjected our bodies to over time.
Lee Health spine surgeon Dr. Dale Segal says that degeneration leads to bone spurs and disc bulges. Both compress on the spinal cord.
Some of the symptoms that those conditions can result in are neck pain or pain that radiates into the shoulder or lower arm, can result in weakness and numbness in the arms.
While many cases can be treated without surgery, doctors say there are times when surgery is the best option.
The goal of the surgery is to remove the structures that are compressing the spinal cord and the spinal nerves. Traditionally, when the disc is removed, a bone graft is put back in its place, and that bone graft is stabilized with screws and a plate.
But a new technique called disc replacement removes the disc and replaces it with an artificial disc.
The benefits of the artificial disc are that it mimics the motion of the natural disc. So it allows for the neck to flex, extend, rotate from side to side. And rather than the forces getting distributed to the other discs the way that it does in a fusion, it absorbs the energy,
offering patients who qualify a quicker and easier recovery after surgery. For Lee Health, I'm Lindsay Morton.